Ankylosing spondylitis is a long-term condition in which the spine and other areas of the body become inflamed. And in this video, I'll provide some exercises that will help with its symptoms. Hi everyone, and welcome to Exercise for Health. I'm Richard, and today I'm going to provide exercise advice for people that are suffering with ankylosing spondylitis, or AS. If you're new to this channel, we offer tips, advice and exercises each week to help you manage your health condition with physical activity. So go ahead and tap the subscribe button below and the bell icon if you want to be notified of when we upload a new video. AS, also known as radiographic axial spondyloarthritis, wow, that's a bit of a mouthful, is a type of inflammatory arthritis that causes pain, swelling, stiffness and damage to the joints, mainly in the spine, but it can also affect other areas of the body. It can result in extreme fatigue and over time lead to poor posture and deformity. It often starts in people who are in their late teens or early 20s, and it's more common in men. Although there is no cure, it's widely reported that exercise plays a crucial role in managing the condition, and it generally helps people with AS feel better. When it comes to developing a regular exercise program, the aim should be to include the following three categories. 1. Mobility exercises, or moving the joint through its pain-free range of movement to keep the joint supple and free from stiffness. I'll provide some examples for this in a bit. 2. Cardiovascular or aerobic training, such as walking, cycling, swimming or using the gym to reduce the onset of cardiovascular disease. And 3. Strength training, using your body weight, gym machines, free weights or other equipment to reduce muscle fatigue, protect your joints and help you manage day-to-day activities. Before I go through some sample exercises for AS, here are my tips for exercising with it. Seek the advice of a physiotherapist who will get to know how the condition affects you, so they can prescribe specific exercises tailored to you. Try to exercise every day for 20 minutes or more, as too much rest will increase the stiffening in the spine. This may not be easy on the days when you have flare-ups, where you may need to reduce the amount or intensity of the exercise you do, but you can then stick to gentle mobility and stretching exercises on those days. Keep your posture in check, as this is most important to slow the degradation of the spine. Always keep your posture in the forefront of your mind. Whether you're sitting, standing, moving or exercising, the position of your spine will ultimately affect the pain symptoms and the progressive nature of the condition. Be cautious with high-impact sports or exercises, as they can lead to increased pain in the spine and other joints. Explosive, jarring or rapid twisting movements may create more problems. However, water-based exercise such as aqua classes, particularly if it's in a warmer pool, will be beneficial. In addition, Pilates, yoga and Tai Chi can also feel therapeutic for people with AS. Finally, as with all exercise and physical activity, start slowly and gradually build up over time. If any exercise causes more than just mild pain or discomfort, then ease back from it. But stay positive and be consistent for improved changes and reduced symptoms in the long term. So let's now look at some exercises that can be done at home without any equipment to help manage ankylosing spondylitis. I'll take you through 8 examples to promote strength, mobility and posture, and you can pick 3 or 4 that work best for you based on your current ability and how severe your AS is. The first one helps you focus on your posture. Start with your back to a wall, ensuring that the heels of your feet and your buttocks are touching the wall. Then press the shoulders back into the wall while pulling the chin in, and at the same time breathe in. Hold it for a couple of seconds, then breathe out and relax before starting again until you have completed this small movement 8 to 10 times. Now we can mobilize the thoracic spine by standing with your hands on the wall the same height as your shoulders and leaning into it slightly. Then lift one hand away from the wall and twist, taking the arm back and looking behind you. And then reverse it, taking the arm under the other one that's on the wall, reaching through. Repeat this movement 4 or 5 times before doing the same on the opposite side. Just ensure that your support arm stays straight all the time and your shoulders don't elevate up towards your ears. Also keep your body straight while rotating so your hips don't drop closer or further away from the wall during the movement. The next exercise can be done seated or laid down on your back with your hands resting on your ribs, and we'll focus on expanding the lungs by taking a deep breath in, moving the rib cage up and outwards, pushing into your hands. This should also expand the chest and abdomen, at which point you hold it for a couple of seconds and then fully breathe out as much as possible before starting again. Repeat this until you've done 8 to 10 breathing cycles. Next, we can gently mobilize the spine by rotating the pelvis. While on your back with your feet and knees together this time, slowly allow the knees to drop over to one side as far as you comfortably can, ensuring that your shoulders remain flat on the floor. You can hold the position at the bottom for a few seconds if you wish, then bring them back up to the middle before dropping them to the opposite side. Perform 8 to 10 of these each way and breathe naturally with the movement. Now, lying on your front, we will mobilize the lumbar spine by doing an extension exercise. Initially, keep your forearms on the floor with your elbows placed directly under your shoulders so they can support you as you lift your chest away from the floor. Make sure the front of your pelvis stays on the ground so you can target the lower back. You can also progress this by placing your arms by the side of your body to use your lower back muscles more to lift the chest up without the arm support. Just make sure you squeeze the shoulder blades together before you begin to lift the torso. Perform this slowly 8 to 10 times and keep looking straight down at the floor at all times. To help strengthen the upper back postural muscles and stretch the muscles across the chest and shoulders that lead to poor posture if they're tight, you can perform arm angels. This isn't easy if you already have restricted mobility, but have a rolled up towel or cushion under your forehead on the floor. Starting with your arms by the side of your body, palms facing down, lift them up and hover them in a circular fashion until the hands touch above your head, then return them back around to the start. You'll feel the muscles on the upper back and shoulders having to work hard to keep the arms raised away from the floor. An easier version is to allow the elbows to bend with the movement, reducing the lever length. Perform the movement 8 to 10 times if you can, and rest your arms by the side of your body between reps if it gets too much. The next exercise is the cat-camel, which is one of the best exercises for spinal mobility. Starting on your hands and knees at hips width wide, obtain a backward tilt of the pelvis which will hump the back, pulling the tummy in while tucking the chin into your chest and pulling the tailbone of your spine underneath you. Then reverse the action, forward tilting the pelvis, dropping the belly button towards the ground, arching the lower back and lifting your head up to look forwards. Repeat this action slowly 8 to 10 times each way, pausing momentarily at the end of each movement. Finally, the bird dog is one of the best exercises for improved spinal stability and core strength. As with the cat-camel, start on all fours and slowly extend a fist-clenched arm out in front of you, while at the same time extending the opposite side leg out behind you. But try to maintain stability in the torso without any twisting or flexing of the spine. Hold the extension for about 5 seconds, bring them both in and then extend again. After you've done this 4 or 5 times, repeat the process with the other arm and leg. Be careful not to try and lift the leg up too high, as this will affect the lower back position. Instead, think of the arm and leg being pulled away from each other with tension. I hope you can take something away from this video today. If so, please give it a like by clicking the thumbs up button below to help this channel grow so more people can benefit from it. Thank you so much for watching, and remember to stay active, keep moving, and I'll see you next week. Thank you for watching. If you enjoyed this video today, please give it a thumbs up. You can also click here to subscribe to this channel or click here to watch a recent video. See you soon.